Hi, great to be with you again on Unified OSCE. We're looking at planning station for fractured neck of femur. It's important to always note that your planning starts from your assessment. Yeah, a brief look at the problem during the assessment. James has been admitted to your orthopedic ward today via the emergency department. On admission to the emergency department, he presented with his right leg externally rotated. An x-ray to James' right hip since confirmed a fractured neck of femur. James initially presented in a lot of pain and has since received analgesia. James was advised to strictly stay in bed, kneel by mouth from 13th hour in preparation for theater. So that's the brief history. Now, based on your nursing assessment, please produce a nursing care plan for two relevant aspects of nursing care suitable for the next 24 hours. This is a silent written station. Please ensure that you write legibly and clearly. You have 14 minutes to complete the station, including all the required documentation. Complete all sections of the care plan. Assume it is today and it is 11:30 hour. Okay. So now, based on the assessment, you can have a look at the previous upload on HVA assessment of fracture neck of femur. So it's just a continuation from that. Now, it's possible you are requested to carry out a pre-operative nursing care plan or a post-operative nursing care plan. It is very important you read the scenario and know what you are required to plan for before you go ahead to do your planning. So for the pre-operative nursing problem, let's just have a look at some of the likely problem that we may have in this scenario. So pre-operatively, James is definitely in serious pain. We know what pain is involved when the neck of femur is fractured. So I will say James is experiencing pain related to fractured neck of femur with a pain score of 6/10. But when you go back to the history given to you, it was stated that the pain has been taken care of. So if I have such scenario and it is written that the pain has been taken care of, then I wouldn't want to go for pain in this kind of situation. So another problem encountered is anxiety. So I would say James is experiencing anxiety related to outcome of surgery. We can also say that James requires safe preparation for surgery. We can also say that James is at risk of fall due to previous history of fall. Those are the likely pre-operative problem that we can identify from the history from this scenario. We can have more, but this is just a sample guide. But what is important is go for the most relevant problem. That's the advice. That's what we always advise in Unified OSCE. Choose the most relevant nursing problem. Now, let's look at some of the problems that might be encountered if you are asked to address the post-operative care plan. We can still have a pain. Pain can still be part of the problem post-operatively if it is not clearly stated that the pain has been taken care of, even post-operatively. So I would say pain, James is experiencing pain with a pain score, for example, 6/10. James is at risk of developing pressure sore related to immobility. James is at risk of infection related to surgical procedure or surgical incision. James is at risk of bleeding related to surgical procedure. James is experiencing impaired mobility. But of course, you go for based on your clinical judgment, you go for the most relevant problem. So now, we just like to address two of the pre-operative problems identified and one of the post-operative problem identified. So I hope this will be helpful. Let's look at anxiety. James is experiencing anxiety due to upcoming planned surgery. The aim of care to relieve James of his anxiety. Re-evaluation. James will be re-evaluated today. Date of my exam in bracket. For example, 230923. Every 4 hours or as soon as clinical condition changes. And if you want to make it every 2 hours or as soon as clinical condition changes, so it depends on your scenario and your clinical judgment, that's fine. And it's hospital inpatient scenario. Now, for the nursing intervention, let's follow the EMATA where it is applicable. Explain, discuss, and gain consent from James for all aspects of care. Monitor James' full set of observation and escalate as per news policy. Teach James on deep breathing exercise and diversional therapy. Administer prescribed medication. Monitor for effectiveness and side effects. Refer James to surgical team or psychotherapy team for further plan of care. Instruct on the use of call bell, then document all aspects of care given to James. Now let's look at the second problem. James is in need of safe preparation for surgery. That's the second nursing problem. The aim of care, James will have safe preparation for surgery or to safely prepare James for surgery. Re-evaluation, James will be re-evaluated today, the date of my exam in brackets, 230923, every 2 hours or sooner if clinical condition changes. Then the nursing intervention, explain, discuss, and gain consent from James for all aspects of care. Monitor James' full set of observation and escalate as per news policy. And if you want to put the monitoring frequency, it will be the monitoring frequency based on your assessment. That is for pre-op, if you're talking about pre-operatively. Ensure pre-operative checklist is completed as per policy. Ensure James signed the consent with the surgical team. Administer prescribed pre-operative medication and monitor for effectiveness and side effects. Teach James the importance of fasting prior to surgery. You can also teach James deep breathing exercise. This will be of help pre-operatively and post-operatively. Refer James to the surgical team for further plan of care. Instruct on the use of call bell. Documents all aspects of care given to James. So that's the two nursing problem identified pre-operatively. Now let's address one of the problem post-operatively in case you are asked to do a post-operative care plan. I want to go for James is at risk of developing pressure sore related to immobility. And point to note, this can also be a problem pre-operatively. If you feel it is relevant, you can use it as a pre-operative plan for this kind of scenario a fractured neck or femur, the patient will be like total bed rest, can't mobilize. So, but post-operatively, I'm going for James is at risk of developing pressure sore related to immobility. Is a risk. So my aim is to reduce James' risk of developing pressure sore. Re-evaluation plan. James will be re-evaluated today, 23/09/23, which is the date of my exam, every 4 hours or as soon as clinical condition changes. The nursing intervention, explain, discuss, and gain consent from James for all aspects of care. Monitor James' full set of observation and escalate as per post-operative policy. Now, please note that because I'm doing a post-operative plan, I won't base my escalation plan on the previous assessment monitoring frequency because now it's a post-operative problem. So the monitoring frequency might be reviewed based on the post-operative monitoring frequency or policy. Assess James skin integrity using the Braden scale tool. Assess for tissue perfusion and palpable pulses in the extremities. You don't have to write all the 3 points under that. One is fine. Just go for whatever you feel is relevant as regards an assessment as regards the skin integrity. Assist James with repositioning every 2 hours. Use pressure relieving devices to relieve areas prone to pressure sore. Administer prescribed medication to James and monitor for effectiveness and side effects. Refer James to the physiotherapist for further plan of care. Instruct on the use of cowbell. Document all aspects of care. And in Unified OSCE, we always advise in your planning station, it is a silent written station. As soon as you sit with your pen on your desk, print your name first, write the date and sign before you start writing out your plan. And that is it for your planning in with with a scenario as regards fractured neck or femur. Can't wait to congratulate you. Bye for now.